will enter the scene. I will assure that the scene is safe. I declare that the scene is safe. And I'm gonna gel my hands following the 7 steps of World Health Organization. Palm to palm, back of the hands, interlace, interlock, interlock, thumb, thumb, fingertips in rotational motion, wrist, wrist, and let it air dry. And I am happy to approach my patient. Hi Mira, I'm Audrey, I'm your nurse for today. How are you doing?
I'm okay.
Good. So Mira, I'm here because I need to do a bit of assessment, taking your observation, and ask a couple of questions while you're admitted. Is that okay?
Yeah, that's fine.
Perfect. Before I proceed, could you please confirm your name and date of birth as I counter check in your ID band and in my chart? Is that okay?
Yeah, that's fine.
Right.
Yes, my name is Mira Abaluni. My birthday is 1/1/1994.
Perfect. And I can see that your MRN number here is 123456. So that's great. I can see that you have a red allergy band here that says that you're allergic to penicillin and brufen. Is that correct?
Yeah, that's actually correct.
And what happens when you take them?
For penicillin, I get anaphylactic reaction, and then for brufen, I get the bronchospasm.
Bronchospasm. Thank you for answering that question. I'll ensure that we're not going to give you any penicillin or penicillin-containing medication, so with brufen. Okay?
Thank you.
So I can see that it's the same here as well in my chart. So I'm here, as I've mentioned, because I need to ask a couple of questions of why you were admitted, what happened. Is that okay?
Yeah, that's fine.
So what I'll do is I'll prepare my materials, and while I'm doing that, I'll be asking you a couple of questions. All right?
Okay.
Perfect. So, Mira, could you tell me why were you admitted in the hospital?
Because I had been having abdominal pains.
Right, okay. And since when did you experience that?
I would say maybe 2 days ago.
2 days ago. What were you doing before you felt that?
Nothing really. It just suddenly
Started, right, okay. You haven't eaten anything that's unusual to what you usually eat?
Not really.
Not really, okay. And you know where you are at the moment?
Yes.
Okay. And do you know what's the date today?
Yes.
Right. What's the date today?
It's February 17th.
That's correct. So I know that my patient is alert and orientated, so that's good. What I will do is, we'll be doing A to E assessment. So it starts with airway down to exposure, and we'll be getting your observations as well along the way. But do not worry, because I will walk you through. If ever there is any instruction that's unclear, you just let me know, okay?
Okay.
Perfect. So first is, I want to check your airway.
All right.
Could you open your mouth for me, please? Right, I can see the airway is clear. Can you give me a good cough? Very good. So I know that my patient's airway is clear and no visual obstruction. Now we're going down to breathing. So there's a couple of things that we need to check. But before I start getting your observations, I'm not hearing any wheezes, stridor, coughing, or rattles as well. I don't see any signs of visual distress like use of accessory respiratory muscles, sweating, cyanosis, or seesaw breathing. So now I just wanted to check if your air entry is equal. So what I'm gonna do is I'm gonna move over here. Do you think you could turn that way for me? Are you happy for me to touch your back?
Yes, that's fine.
Right. So I'm gonna have to ask you to inhale deeply, exhale, perfect, and can we do that again? Exhale, lovely, perfect. So you can sit back again on your chair, so that's lovely. Now what I wanted to do is I want to check your pulse rate. So I'm going to be checking that for the first minute, and I will counter check that for another minute. I will be silent during those 2 minutes, and I will appreciate if you could do the same, okay?
Okay.
So assessor, what I will be doing is I will assess for 1 minute for pulse rate, and for the next minute I will assess for respiratory. I'm not telling my patient because sometimes that alters the result. So assessor, can I confirm if my machine has been calibrated in the last 24 hours?
Yes.
Perfect, thank you very much. So what I will do now is I need to get your blood pressure, your oxygen saturation as well. Do you have any preferred arm to use?
You can use my right arm if that's okay.
Yeah, no problem. So I don't see any cannulas, any bruises or signs of infection on this side. You didn't have any operation on your right arm.
No.
Perfect. So what I'll do is put that in, making sure that's in the upper 80% of your arm. 2 finger breadths inside. You might feel a little bit of tightening, but do not worry because that will go off soon, okay?
Okay.
And this one will measures your oxygen saturation. So I don't see any nail varnish, no signs of infection as well. And as I check the capillary refill for 5 seconds, 5, 4, 3, 2, 1, and that comes back less than 2 seconds. So I'm happy with that. So I'm gonna start the machine now. So while we're doing that, I'll be checking my pulse rate and for the first minute using my fob watch. So I will be silent for the first minute, okay?
Okay.
And my 1 minute timer starts now. Lovely, so that's 1 minute. Your pulse rate is 88 with the rhythm and the strength, which is good. And your oxygen saturation is 98% in room air. And your blood pressure is 119/57. What I'll do is, I'll just put this back for a little bit, right? I'll remove this, because sometimes the machine makes a loud noise when I remove this, okay? Put this back on your finger there, thank you. And I'm just gonna counter check for another minute, okay? So perfect, thank you very much. So the respiratory rate of the patient is 18 with the depth and the strength as well, or the rhythm rather, is all equal and normal. So I'm happy. So I think we've done with the airway. We're done with the breathing. For your circulation, as I've mentioned, the rhythm and the strength of your pulse is good. Your blood pressure is 119/57. Your capillary refill returns less than 2 seconds. I've felt that you are warm to touch as well when I was checking. Other ways that I could check this, I could check both your extremities, but I'm happy that they're all warm to touch. And for your pallor, could I just check your palms? Perfect, so that's pinkish. There's no sign of pallor. Another way to check it as well is to check the lower eyelids of the patient to check for the lower conjunctiva of the patient, but I'm happy with that. So now that we're down to disability, you're alert and orientated as I've mentioned earlier. Do you have any pain at the moment? Are you experiencing that abdominal pain as we're currently speaking right now?
Yes.
If you're gonna give me a pain scale of 0 to 10, 0 being no pain, 10 being the worst pain that you can imagine, what would be your pain?
I would say 6.
6. So that's a bit high. Are you still comfortable for me to proceed?
Yeah, that's fine.
Right, okay. I'll make sure that I'll have a look later in the chart of what analgesia I can give you, okay? How about with your urine output or bowel movement? Do you see anything unusual?
I'm actually quite regular.
Good. And have you just had a wee, or when did you last have a wee?
Maybe half an hour ago.
Half an hour ago, okay. With your blood glucose, I didn't see any past medical history of diabetes, but do you have any diabetes?
No.
No. And do you know if your blood sugar has been checked recently?
I think it was recently checked and it's normal.
Normal, okay. Do we know the value by any chance?
I think the nurse said it's 6.
6, right, okay, lovely. So what I will do now is going down to exposure is to check your temperature. So this is infrared. We're just gonna point it to your forehead. I can see that it's clear, no signs of infection. And I'm just gonna quickly check that. Lovely. And it says 36.3. So that's good. That's within normal range is 36.5 to 37.5, but 36.3 is okay. Do you feel warm though yourself?
No, I'm okay.
You're okay. Lovely. And I don't see any bleeds, rashes, injuries, or bruises. Do you have any of that sort that you wanted to report to me?
I don't think.
Perfect. And as I've mentioned, apart from what other past medical history do you have? I can see you've had asthma.
Yes, actually.
Do you take inhaler for that?
Yes, I take salbutamol.
Salbutamol. Right, okay. I'll have a run through later with your past medical history, okay?
Okay.
I think we're done with everything. The A to E observations. I'll be asking you a couple more questions later on, but let me just document all the findings that I have done, okay?
Okay.
Perfect. So just remove that. You've got the call bell beside you and Mira, so just let me know if you need anything, but I'll literally be beside you, okay?
Okay.
So what I'll do is, I will write first my observations here, so I could switch off the machine. So my blood pressure is 119/57, and your oxygen saturation is 98% in room air. Your temperature was 36.3. Your pulse rate earlier was 88, and your respiratory rate is 18. So I'm happy with that. So I'll switch this off because it's making a sound. And now I'm gonna document. Your date of birth is 1st of 1st, 94, and you are admitted today, 17th of February, 2023, and the time in our scenario is 10 a.m. 98% room air. Room air. And your blood pressure is 119/57. And your pulse rate is 88. You're alert. And your temperature is 36.3. And having said all that, my patient is scoring 0, which would require her monitoring of at least 12 hourly. I will not escalate, and I will put my initial. Right, so Mira, thank you so much for waiting.
That's okay.
Your NUTH score is 0, which will require us to monitor you at least 12 hourly. But if ever I will come in to check for your pain and all that, I could still check your observations. If you feel unwell in between those 12 hours that we're not here yet, you just let us know. Okay? So now what I wanted to do, Mira, is just to run through with you your chart, okay?
Okay.
I can see that you have glasses here on your bedside table. Is this prescription or reading glasses?
Just for reading purposes.
Reading. Are you okay to not wear this at the moment? Can you see me clearly?
Yeah, I can.
Lovely. So I'll put it here near you so it's easier or within your reach, okay?
Okay.
So I'll run through the chart with you and confirm all the details, and feel free to add any more details, okay? So it says here that you're transferred from A to E, where you presented with abdominal pain, which you gave us a score of 6/10 earlier, and you were treated with analgesia and antiemetics.
Yeah, that's right.
Do you still feel nauseous?
No, I'm okay.
You're okay, that's good. So you were transferred here in the surgical assessment unit at 8 a.m. where you are currently, and you mentioned that your elimination system, that your stool is actually a little bit black, but earlier you mentioned that it was okay. But it says here, this is due because you're taking ferrosulfate for your anemia.
Yeah, that's right.
Can you confirm that?
Yes.
Lovely. And if ever there's any new color in your bowel movement, apart from the usual black and stool because of the ferrosulfate, please do let us know.
Okay, I will.
Usually you're mobile and independent, but you express that you might need a little help because of the abdominal discomfort.
Yes.
Could you elaborate what help would you need so that we could, we know, so I could endorse as well?
Maybe just like going back and forth to the toilet if I need to.
Okay, no problem with that. What I'll do is I'll make sure I'll leave the call bell, or you have the call bell beside you within your reach, and I will leave both side rails up just so you could have something to grab onto.
Okay.
And just, I will put everything within your reach as well. But if ever you need anything, just give us a buzz, okay?
Okay.
So you are scheduled for your emergency appendectomy today at 6:30 in the evening, and we are currently at 10 a.m. So I'll have a look if you could have something to eat and drink, or if you need to be nil by mouth, okay? So some of your past medical history, it says here that you've got asthma, which you've mentioned. You've got eczema, is that right?
Yeah, that's right.
Do you take anything for it?
I just put some lotion.
Some lotion, right. And you have anemia as well, which was mentioned, you're presenting complaint, and you take ferrous sulfate.
Yes, that's right.
Did you bring any of your tablets with you?
I was, I forgot actually at home.
That's fine. What we'll do is the doctor will have a look through of all the drugs that you're taking or the medication that you're taking, and then whatever tablets that you need, we will be able to provide here, okay? So social history, you drink 2 to 3 times a week socially, no more than 2 units every time as verbalized. So is that correct?
Yes.
Good. And you are a non-smoker?
No, I don't smoke at all.
Thanks for confirming that. And that you live in a 2-story house, and that you are a vegan by food preference.
Yes.
So if you want, I could give you a leaflet or a menu, so you could choose the vegan menu. And if ever that you need referring to the dietitian for nutritional support or advice, I'm more than happy to do that. Drug history, it says nil here, but the doctor will review your chart anyway.
Yes.
And your allergy, as I've mentioned, is mentioned here. So other than that, just to let you know, we have chapels in the hospital as well, open for any kinds of religion, should you need any specific religious practice that you do as well. Who's your next of kin, by the way?
My daughter.
Your daughter. What's your name?
Sophia.
Sophia. Lovely. And does she know that you're here in the hospital?
Yes.
Perfect. So we've talked about your physical, psychosocial, spiritual, and other than that, who do you live with at home?
I live with Sophia.
Sophia, right, okay. And do you have any partner or anyone that you would want us to contact? Just in
No,
case.
I'm single mom.
You're a single mom, okay, no problem with that. And we will let Sophia know as well of the updates if ever she rings us, if you're happy for us to disclose information.
Yeah, that's fine.
Perfect. I think we're actually sorted with everything. Mira, thank you so much for that. Do you have any questions for me?
No, can you just let me know if I can still eat or drink?
Yes, I'll be more than happy to do that. But at the moment, I think we've documented everything. We'll monitor you at least 12 hourly. We've asked most of the questions in relation to your admission, and I will get back to you whether you can eat or drink.
Okay, thank
Lovely.
you.
Thank you very much, Mira, for answering all my questions. Just give us a buzz if you need anything, okay?
Okay.
And I'll be ending my station by following the 7 steps of World Health Organization: palm to palm, back of the hands, interlace, interlock, interlock, thumb, thumb, fingertips in rotational motion, wrist, wrist, and let it air dry.